The outbreak of Ebola in Liberia is over. The World Health Organization made the announcement at a ceremony in the country's capital, Monrovia, to mark zero transmission rates, the first time since the outbreak began in March 2014.
42 days have passed since the last laboratory-confirmed case was buried on 28th March. The criteria established by the World Health Organization have been met.
Liberia had reported the highest number of deaths in the largest, longest and most complex outbreak since Ebola first emerged in 1976. At the peak of transmission in August and September 2014, Liberia was reporting up to 400 new cases every week. At one point, virtually no treatment beds for Ebola patients were available in the country. Before an audience of Ebola survivors, local officials, and Liberian President Ellen Johnson Sirleaf, the UN's Ebola response chief officially ended a crisis that lasted over a year and claimed thousands of lives.
Now is the time to start the healing of a nation, its social fabric torn, families in mourning, orphans, all of us remembering the sirens and the horrible sights of August, September last year. But now is the time, Madam President, to be proud of the communities who so clearly demonstrated the inner strength of the Liberian people.
But as a mood of jubilation consumes Liberia, the concerns surrounding Ebola have not yet subsided. Just this week, Italy announced its first case of the disease in Rome. Violence in Yemen has killed nearly 850 civilians since mid-March, including about 182 children. But UNICEF warns that if fighting continues, as many as 120,000 children face an even bigger threat: severe malnutrition.
If restrictions on the commercial imports of food and fuel continue, then it will kill more children than bullets and bombs in the coming months.
A humanitarian pause in the conflict this week has enabled ships carrying much-needed relief supplies to dock in Yemen, but emergency teams continue struggling to reach increasingly vulnerable civilians.
Fuel may run out completely in less than a week in Yemen. In this difficult situation, UNICEF is delivering vital health, nutrition, water, sanitation and protection services across the country. However, our humanitarian access to many areas is extremely difficult, and we are frequently being blocked by parties to the conflict from going to places where people need us most.
A new 7.3 magnitude earthquake struck Nepal on Tuesday, 2 weeks after a devastating earthquake killed more than 8,000 people and destroyed infrastructure. Nepalese officials said more than 48 people were killed and at least 1,000 injured in this latest tremor, which hit just as aid operations were underway to deliver supplies to affected populations. Within hours of the new quake, the United Nations World Food Programme carried out an aerial assessment mission with the emergency coordinator, Richard Reagan, flying by helicopter to the affected area and speaking to officials on the ground.
We just initiated a rapid assessment in response to this recent earthquake, which happened in the eastern part of the country. We wanted to quickly determine whether staff was safe, whether there had been any impact to our operations, our ongoing operations, and also get a sense of if there were new areas that were impacted.
WFP has mounted a massive response to meet the needs of the survivors of the April 25th earthquake. It has distributed food to nearly 1 million people in 6 districts, which it says is immensely challenging due to the mountainous terrain and remoteness of the affected locations.